Hi students, here is the narration for the urinary system, and this is our last topic in this course. So the first 6 slides will focus on the big picture, what we call gross anatomy, and then we will have to focus on the physiology of urine production. And a fact you may not be aware of is that 1/5 of the total volume of blood in the body, so the total volume is about 5 liters roughly, so 1 liter passes through the kidneys per minute. And the kidneys' job is to filter the blood, remove substances that are basically going to be toxic to the body, and send them out in some water, and that's basically what we call urine. Beyond that, the kidneys, the urinary system actually does help with balancing blood pH and water balance, etc. However, in this course, we don't go into those details. So we'll primarily be looking at the urine production process. And for that, we have to look at the microscopic structure called a nephron, in which the kidneys have millions of nephrons. So let's begin. So we have left and right kidneys. Let me grab my pen here. So left and right kidneys, in terms of their location, they are not in the pelvis, which is sort of sometimes where I think sometimes, we think that's where they are. They're actually around the last rib number 12, thoracic vertebra, and then the first 3 lumbar. So a little experiment you could do is if you take your hand and put it at your waist, so your thumb is pointing behind you, and you stick your thumb up, the tip of your thumb is roughly touching the bottom of your kidney, and that would give you an idea of where the kidneys are located. Now, they're also surrounded by a nice pad of fat because they're very dorsally located, so more towards the back, which means that if you get, hit in that particular region at the back of your body, they could sustain some damage, and the fat tends to be protective of them. Now, what we see here in the diagram, so we've got our left and right kidneys. This area where this tube, you see this tube entering here, that's the area called the hilum. But the tube that you see leaving the kidney and sort of flowing downwards, that's called the ureter. So pay attention because there are 2 words that sound very similar in the urinary system, the word ureter and the word urethra. So ureter is simply a passageway, it's a tube that will take urine from the kidney to the urinary bladder, which roughly would be about there. Here is a look at the urinary bladder in a little bit more detail. So we see the ureters there entering the urinary bladder. We know the bladder is basically like a sac. It collapses when it's empty, and then it fills slowly throughout the day. It can hold roughly about 500 mils of urine maximum before there is the urge to go. Now the walls of the bladder contain thick, smooth muscle which allows it to expand to hold urine. And we can see that there is a passageway leading out or away from the urinary bladder. That one is the urethra. So that would be the urethra. And both males and females have a urethra. So we also know that there are sphincters. There's an internal sphincter and an external urethral sphincter, and they help to regulate the flow of urine out of the bladder. So the function of the urinary bladder is to store urine, temporary storage site. If we take a cross section, so this is our ureter, and we cut like that, And then we look at this face here. So we see the lumen, the space. This is where the urine will basically be traveling. And then we see that there's smooth muscle. Adventitia is just sort of like a basement kind of tissue that everything is attached to. But the important part here is that the urine flowing in the ureter uses peristalsis, the same movement that you learned about in the digestive system that helps to move food through the esophagus and other parts of the digestive system. So peristalsis is achieved by wave-like contractions of this smooth muscle layer that's found in the walls of the ureter. Male versus female urethra. So in Biolum 50, you would have done a little bit on the reproductive system. So this should just be a reminder, really. The urethra transports urine from the bladder to the outside of the body. And so here we see this is the female urethra. So the urinary bladder is right here. And superior to it, roughly, this is the womb or the uterus. So when a woman is pregnant, the uterus obviously expands because the baby is in there growing, and that puts a lot of pressure on the urinary bladder, causing that female to sort of want to urinate frequently. So that's, one of the hazards, shall we say. Males, they have a urethra that passes through the penis. And so the urethra is part of both the reproductive system in males and the urinary system in males. That is not true in females. Females have a reproductive system. So from the uterus, there's an opening there to the vagina. Then here would actually be the digestive system. So that would be the anus right there. So in males, we see that there is an anus, but there is no other opening. So this here is the bladder. So the important thing is that to note is that the male urethra is longer than the female. It transports both urine and semen outside the body, but never at the same time. Okay, so moving right along. Now, if we were to take a longitudinal section through a kidney, what would it look like? So there are a fair number of details here that you should make sure you understand. So first of all, let's orient ourselves. So we have the structure of the kidney here, and we can identify the ureter. So that's the ureter there. Entering the kidneys are the renal artery, which would be carrying oxygenated blood, the renal vein, which would be bringing away deoxygenated blood away from the kidney, and a renal nerve. And all of these enter the kidneys at this spot called the renal hilum. Now, the important parts of this slide are two things. The blood vessels, which we'll talk about in a minute, but the labeling that goes along with the kidney. So when you see a kidney actually in a grocery store, it usually glistens. It's very shiny, and that's because the outside has a capsule. That's a connective tissue covering that encapsulates the entire kidney. Now, beneath that layer is the first layer called the cortex. So this is the outermost layer here. Then we see these triangular structures here, which are actually referred to as renal pyramids. And the renal pyramids have a bit of cortical tissue between them. That cortical tissue is what's referred to as a renal column. And the pyramids, the triangular structures are called renal pyramids. They are in the medulla. So cortex is always to the outside, the outermost region, because cortex means bark, like the bark on a tree, which is on the outside. Medulla means middle. So the renal pyramids are so here's the word pyramid, in the medulla. Now, what we will learn is that those structures called the nephron, which you can't see in this diagram because nephrons are microscopic, they are mostly present in the cortex. Parts of them may extend into the medulla. But the reason I'm telling you that is at the sort of bottom part of each renal pyramid are cup-like structures that are called calyces. And so we have a minor calyx, that's shown here, and many minor calyces, so they're always at the bottom, sort of the tip of the pyramid. Many minor calyces merge to form what is called a major calyx. Now, the urine is formed and it travels to the minor calyx first, then the major calyx, and then the major calyx leads into a structure called the renal pelvis, and then the renal pelvis leads to the ureter. So if we were following the path of urine, that's what it would look like on a macroscopic view. So the other thing to notice are their extensive, so when you look at the kidney again in a grocery store, the color is like the liver, very dark red. Which tells you that it's highly vascularized. There are lots and lots and lots of blood vessels in it. So what we see is the renal artery comes in to the kidney and starts to branch right away. You are not responsible for knowing all the different names of the blood vessels. We will tell you which ones you need to know. But there are what are called segmental arteries, because these arteries are the first branches off the renal artery. Then we have some interlobar, which means they're kind of between these lobes, if you call the pyramids lobes. Then they bend sort of around, like form an arc, so they're the arcuate blood vessels also. Just remember that there are lots of blood vessels. There are a few that we will have to pay attention to, but it's actually not these here. So the renal artery supplies each kidney with blood to filter. Very important. The renal artery will enter the kidney at the hilum and subdivide further into smaller arteries and arterioles. The renal cortex is the outermost region of the kidney. Most of the blood will be filtered in the cortex by that structure called the nephron. The renal pyramids and renal columns make up the renal medulla. Urine collects in the minor and major calyces, which is part of the renal pelvis. The ureters extend from the renal pelvis to bring urine to the urinary bladder, which we learned in a previous slide. And the renal vein, of course, will return freshly filtered blood back to the heart, but it's also deoxygenated blood. So nothing different from what you learned when you did the cardiovascular system. Now we get to sort of the more interesting part of the urinary system. So as you can see in this diagram, each kidney is highly vascular. It contains many blood vessels. And so the renal artery branches to give segmental artery, which then branches to give interlobal artery, which then branches to give the arcuate artery, and then the cortical radiate artery, because those are in the cortex, the outermost region here. The blood vessels that we want to pay most attention to are these, something called an afferent arteriole, something called a glomerulus, something called an efferent arteriole, and the peritubular capillaries. So this entire structure that is being shown here, that is a nephron. Nephron with its accompanying blood vessels. So as I said when I first started, this is really the physiology of urine production. And so we need to understand the parts of a nephron, and then we need to understand exactly what happens in each of those parts of the nephron. So small arteries, known as afferent arterioles, will bring blood to each filtration unit called a nephron to be filtered. So what's shown here is sort of a branch. This here is a branch of the renal artery. It's really a cortical radiate artery, actually, that's branching to give us the afferent arteriole. So we have these two words, afferent and efferent. Afferent, always with the A, always means going towards something. Efferent, with an E, is like exit. It always means away from something. So what is the something? Well, it's this knot of capillaries that we see here, and that knot of capillaries has a name. It's actually called the glomerulus. So the afferent arteriole leads to the glomerulus, and the efferent arteriole leads away from the glomerulus. The efferent arteriole is what forms this set of capillaries called the peritubular capillaries that wrap themselves around this beige colored tubule system. So the red blood vessels, capillaries, the beige structure here, that's a tubule system. That's part of the nephron tubule system. And we will be learning the parts of it in a minute. So when we look at the diagram of a nephron, we really want to be able to distinguish the blood supply versus the tubule system. So again, the blood supply would be a branch of the cortical radiate artery leads or gives off an afferent arteriole that leads into the glomerulus. Leaving the glomerulus is the efferent arteriole, which then branches to form the peritubular capillary network. So the peritubular capillary network eventually will bring blood to a vein, the cortical radiate vein, which eventually sends blood to the renal vein. So just as how we had a series of arteries, segmental, interlobar, arcuate, cortical radiate, that were all branches from the renal artery, similarly, there's a series of veins, cortical radiate vein, arcuate vein, interlobal vein, all of which send their blood to the renal vein. There's no segmental vein. So we already said that there are millions of nephrons in the kidney. Most parts of the nephron are found within the renal cortex. Something called the loop of Henle, or the loop of the nephron, can extend deeper into the renal medulla, and there are two sets of capillaries which we just went through. So what is the loop of the nephron? Well, surrounding the glomerulus, so that's the glomerulus. The glomerulus is a knot of capillaries. Surrounding it is a cup-shaped structure, this structure here. We are going to name that cup-shaped structure the glomerular capsule. The old name was the Bowman's capsule. Then leading from it is the first sort of very convoluted, twisty, turning, beige colored tubule system, goes all the way down here. And I'm going to mark it off right there because you can see that it narrows significantly and forms, I'm going to put this in a different color, and forms a hairpin bend right there. And then I'll put another line there. So this first part is what we call the proximal convoluted tubule because it's closer to the nephron, to the glomerulus here. That U-shaped hairpin bend, that is the loop of the nephron. Old name, loop of Henle. And then this tubule continues, so it widens again, and then it continues upward, and this part is called the distal convoluted tubule because it is further away from the nephron. And that's the distal convoluted tubule. And technically, those are the three most important parts of a nephron. You're going to see that the distal convoluted tubule leads to something called the collecting duct, and the collecting duct leads to the renal pelvis. So let's go to the next slide. and review blood. So the components of blood. Remember, blood has a liquid portion that we call plasma, and then a sort of solid portion that we call the formed elements. We know that if we look at the formed elements, we would find white blood cells, red blood cells, and platelets. And in plasma, because it is mostly water, we find substances that can dissolve in plasma. Proteins, glucose, amino acids. Notice that proteins are not amino acids. Amino acids are amino acids. Proteins are big structures, the macromolecule. Hormones, we have ions, sodium ions, all the different ions you can think about. Immunoglobulins, which are antibodies, right? In blood, you will also find drugs if somebody's been taking antibiotics, for example. We also have, this is very important, nitrogenous waste, because I don't think in any other organ system we really talk about nitrogenous waste. So what are these? Well, the names are urea, ammonia, and uric acid. And these are the product of protein digestion. On the slide, this is ammonia. So ammonia has the structure NH3. And the blue ball in the middle is nitrogen. So this is nitrogen here in all of these images. The blue ball is nitrogen. And the white ball here, this is hydrogen. So that's NH3, that's ammonia. This is urea. So urea has a carbon atom and an oxygen atom and then NH2 on either side. Now, the majority of our nitrogenous waste, so all of them have lots of nitrogen. Why? Because they're coming from proteins. Proteins are made up of amino acids. And if you remember the structure of an amino acid, typical amino acid has NH2 bonded to the carbon, COOH bonding to the other carbon. That will be a hydrogen there, and then it has an R group. But all of these with their nitrogen, they're getting the nitrogen from that group there. And every amino acid has this NH2 group. So why don't we, just excrete one nitrogenous waste? Well, the truth is different proteins will break down differently in the digestive system. Ammonia is very toxic. So the liver actually takes ammonia and converts it to urea, which is not toxic. It is highly soluble, so it can go out in urine. And it's a small molecule, which makes it easy to transport. Uric acid, as you can see, is a much larger molecule. Uric acid is mostly what birds excrete because uric acid tends to be crystalline, like sort of more of a solid. So only a very, very small percentage of our nitrogenous waste is actually uric acid and ammonia. The majority is urea. Okay, so we want to talk about processes of urine formation now. So this is a better look at the nephron. It's all labeled for us. So let's see. Blood is delivered to each nephron via the afferent arteriole. So very important. Here's the afferent arteriole right there, which brings blood to the glomerular capillaries. So glomerular capillaries and glomerulus are identical. It's the same thing. It's these capillaries that are in here. There. Within a capsule, which is called the Bowman's capsule, so glomerular capsule or Bowman's capsule, that's a cup-shaped structure right there. So this is blood with everything that we possibly could find in blood. That's what's coming there. There's nothing special about this blood. It is whole blood. But what is not shown in the diagram is that the afferent arteriole has a larger diameter than the efferent arteriole. So again, it's like water going through a hose, and it's a big fat hose, and then that fat hose is connected to a hose with a smaller diameter. And so when all that water that was gushing through the fat hose arrives at the smaller hose, the pressure builds up. And that's exactly what happens here. So pressure increases inside this area, the glomerulus. So a process that occurs there is called glomerular filtration. So it's called glomerular because it happens in the glomerulus, nowhere else. It's called filtration because it's going to be like when you filter something, in a lab. If you had a substance to filter, you would get a funnel. You will put a bit of filter paper in it, and you will put your substance in there. And the large particles will remain behind on the filter paper, and the small, drops of fluid will come through. The small drops of fluid coming through, this is referred to as the filtrate. And that's the word we're going to use to describe what passes through the glomerulus. So the glomerulus functions like a sieve. That's an important thing to remember. Because it's a sieve, so just like a sieve in the kitchen also, you can have a sieve that has really large holes, or you can have a sieve that has really tiny holes. And a sieve that has really tiny holes will keep much more of the solid substances out if you have a mix of substances there. So the filtration that occurs in the glomerulus is based on size of particles, size of molecules. So here, small substances within the blood leave the glomerular capillaries and enter the capsule. So we're going to get some filtrate collecting down here and going in this way. So it's easy actually to remember, everything in blood that is small will pass through. The things that do not pass through are those cells, red blood cells, white blood cells, and platelets, and proteins. So they can pass through and form part of the filtrate. So they move, they stay in blood, and they just keep moving. So they are in the efferent arteriole. So one of the things you do need to be able to do is to say precisely, if I say glucose, is glucose present in the afferent arteriole? The answer is yes. Is glucose present in filtrate? The answer is yes. Is glucose present in the efferent arteriole? The answer is no. If the substance is present in filtrate, it is also not present in the efferent arteriole. If I say white blood cells, are they present in the afferent arteriole? The answer is yes. Are they present in the filtrate? No, because they're too large. So they stay in the blood and they go into the efferent arteriole. So are they present in the efferent arteriole? Yes. So for these substances, I find it easier if students focus on water, glucose, amino acids primarily, and just remember that proteins, any proteins, the antibodies, fibrinogen, albumin, all of those cannot be filtered. So they will never or should never be in filtrate. So large substances such as blood cells and proteins remain in the blood and leave through the efferent arteriole. This is called glomerular filtration, which separates the components of blood based on size. So what is present in filtrate then? That's a good question to answer. And the list you want to keep in your head is water. So that would be water from plasma. Glucose, because glucose is a small molecule. Amino acids. And ions like hydrogen ions, bicarbonate ions, potassium ions, etc. But these three, you want to follow me now as we move along the nephron to understand what happens to them. And so, if the substances infiltrate, these water, glucose, and amino acids, if they were to stay infiltrate, they will go through this beige tubule system. The first part here is the proximal convoluted tubule. Then they'll go through the loop of Henle. Then they'll go through the distal convoluted tubule. Then distal convoluted tubule leads to the collecting duct. And hey, in the collecting duct here, this is called urine now. It's not called filtrate. These substances will end up leaving the body if nothing else happened to them. Well, what would be the benefit of that? If we keep losing water all the time, if we keep losing glucose and amino acids, what's the benefit then? None. So these substances specifically have to be returned to blood so they can circulate in blood and be of use to cells. So the urinary system, the nephron in particular, helps with the maintenance of glucose levels in blood, of water level in the body, and of amino acids also, as well as other ions. So here we are. Now I need to clean this up. So let me just clean this up here. I'll leave the water and glucose showing because I might need to refer to it. Okay, that looks a little bit better. Okay, so if we imagine that these three substances are here in filtrate and they will follow the proximal convoluted tubule, they'll flow in the proximal convoluted tubule. Now in the proximal convoluted tubule, which ends here, there is another process, and that process is called tubular reabsorption. So the definition of tubular reabsorption is that substances are moved from the tubule and put back into blood. So the water will be reabsorbed into blood, the glucose will be reabsorbed into blood, and the amino acids will be reabsorbed into blood. So by the end of the proximal convoluted tubule, all of the glucose should be reabsorbed, all of the amino acids should be reabsorbed, and about 60% of the water should be reabsorbed. So they all are put back into blood. And that explains why the peritubular capillaries are wrapped around sort of very intimately here with this tubule system of the nephron, because it allows for substances to be moved from tubule into blood and from blood into tubule. So we have this 60% of water reabsorbed, and now we're at the loop of Henle. The loop of Henle has a descending limb, so descending limb, and it has an ascending limb. The descending limb is very permeable to water, so a further 20% of water is reabsorbed in the descending limb. The ascending limb is not permeable to water, but it's permeable to sodium ions. So sodium ions will actually be reabsorbed there, and wherever sodium goes, chloride will go and water will follow. So it's kind of an indirect way to get more water reabsorbed. So that is tubular reabsorption. So everything that I just told you is found in this area right here. Now, as we go up the tubule, this is the distal convoluted tubule here, right? So the distal convoluted tubule, we need to figure out what happens to the 20% of water that's still remaining behind. That 20% of water remaining behind is actually moderated by the use of hormones. So if you are drinking, adequate amount of fluids, you're very hydrated, then you will produce a normal volume of urine, because that water will probably just make its way down here to the collecting duct and it will emerge as urine. But if you're dehydrated, or you're tending towards dehydration, then the body does not want to get rid of that last 20% of water. So here, in both the distal convoluted tubule and the collecting duct, one of those hormones that you learned about when you were studying the endocrine system, ADH, antidiuretic hormone. This is where antidiuretic hormone acts on these two here, these two tubules. And antidiuretic hormone will be secreted because the hypothalamus monitors our water balance in the body. So ADH will be secreted, and it basically tells these cells here, to open up these aquaporins and allow water to be reabsorbed. So if you're dehydrated, then you do not produce a large volume of urine. It will be a small volume of very concentrated urine. So I'll clean up again. So that's a story for water and glucose and amino acids. What else is there? Well, we have wastes, and we have a third process, something called tubular secretion. So tubular secretion is the reverse of tubular reabsorption. So tubular reabsorption was substances moving from the tubule system into blood. And tubular reabsorption could also occur in the distal convoluted tubule. Any of that excess water that needs to be kept, it will be reabsorbed there. Tubular secretion is where substances that are traveling in blood. So sometimes drugs are too large to be filtered here in the glomerulus. So they can't make it into filtrate, so they have to travel in the blood. But we don't want them staying in blood. We want them to get out of the body. So they can then be put from blood into the tubule system. And this can also happen in either the proximal convoluted tubule or the distal convoluted tubule. So substances like penicillin, for example, excess hydrogen ions, some of these will be actively removed from blood and put into the tubule system so that they will be gotten rid of in urine out of the body. That's what tubular secretion is. So much of what I discussed on that slide is here in greater detail. So I'm not going to waste your time saying it all over again. Basically, the glomerulus is shown in a little bit more detail. You would be wise, to make sure you read this and go over it. Afferent arteriole leading into the glomerulus. The efferent arteriole is there, and then you've got the Bowman's capsule or the glomerular capsule, and then that's the beginning of the proximal convoluted tubule. So we know what glomerular filtration is, and we also know how it operates, right? So we can move on to the next slide, and this is showing the nephron. So nothing really new here. You need to be able to label this diagram accurately, and again to state which processes occur where and which substances, So like I said, all of the glucose should be reabsorbed by the time the filtrate gets to the end of the proximal convoluted tubule. All of the glucose should be reabsorbed. I think we all know that someone who is a type 2 diabetic, one of the symptoms is to have glucose in urine. That's very abnormal. So glucose is present in their urine because they have so much glucose in blood. And the cells here in the proximal convoluted tubule, while they work hard at removing all the glucose, they can't remove all of it. So some of that excess ends up in the urine, and that's why we would see that on a urine test. Tubular reabsorption and tubular secretion. I have one disagreement with this diagram, which is this. So what it's showing you here is this is the Bowman's capsule. So the blood capillary system is removed from the diagram. And this first part here is the proximal convoluted tubule, obviously, going all the way down to, again, there, which would be where the loop of Henle starts. This list here has protein in it, and that is wrong. Protein is not part of filtrate, which I think is what this arrow is trying to tell you, that these substances can be moved out of the proximal convoluted tubule and moved back into blood. So all of these ions here, they're usually monitored for how much the body needs. So if we don't need any more bicarbonate ions, then a lot of bicarbonate ions are not reabsorbed. They're just allowed to go out in urine. So glucose is here, amino acids is here, vitamins are here. I mean, if we have excess vitamins, they would go out in the urine too. Urea some of it is reabsorbed. So this one I do need to talk about because that may seem unusual because it's a nitrogenous waste. So what are we doing reabsorbing it? Well, I'll tell you in the next slide. Then when the arrow is going in the opposite direction like this, what it's suggesting is tubular secretion. So hydrogen ions, if we've got too much, they will make our blood very acidic, so we get rid of some of it. And in this way, the urinary system helps to regulate blood pH also. Same goes for potassium ions, ammonium ions, and you'll see here water is reabsorbed and some urea is reabsorbed. Now, and then here we see that, so urea can undergo tubular reabsorption and it can undergo tubular secretion. So this part here, the loop of Henle, we already spoke about water. We said another 20% of water will be reabsorbed in the descending limb, only the descending limb. The ascending limb here, is permeable to sodium. So it isn't so much the distal convoluted tubule, it's really the loop of Henle. But what is urea doing being reabsorbed? And the answer is this part of the nephron is usually in the medulla. And urea is used to increase the osmotic gradient in the medulla compared to the cortex. Because if you have a high osmotic gradient here, then it's easier to pull water out. Remember, water always moves towards salt. So this makes for a more efficient process of moving the water out from the tubule, instead of if you leave it, it will go out in urine. So the water is moved out into the blood capillaries. But that's what urea helps with. And the same thing for sodium. That's what the sodium ions help with. So important nutrients are reabsorbed from the PCT and DCT into the peritubular capillaries. So they are not shown on the diagram, but that's where they will go. This is called tubular reabsorption and is indicated by arrows moving away from the tubules. About 50% of nitrogenous waste, such as urea, is reabsorbed. So like I said, that's to help with the osmotic gradient. Waste and excess ions, drugs, etc., they are moved by tubular secretion, which is taking them from the tubule and taking them from blood and putting them into the PCT and the DCT so that they will go out in urine. And then a little bit about salt and the loop of the nephron, the loop of Henle, and the importance it plays. So water balance in the body is very important because water balance or water volume affects blood volume. If water volume falls, blood volume falls because plasma level will fall. And when blood volume falls, blood pressure will fall too. So to keep blood volume and blood pressure normal, the amount of water in the body needs to be monitored and kept as normal as possible. So the collecting duct, this part here, like I said, when the filtrate has arrived down here, it's now called urine. And so urine has, water, urea, penicillin if you've been taking, antibiotics, etc., and excess ions. So urine will concentrate in the collecting duct, which leads to the calyces of the renal pelvis. So the loop of Henle, this is a little bit more about the loop of Henle, and everything I just told you is here. This bit about maintaining blood pressure and blood volume is not to be forgotten, even though we are not discussing it in great detail. So what are the characteristics of urine? Urine is mostly water along with urea, so the nitrogenous waste, any excess ions, hydrogen, bicarbonate, potassium, excess vitamins, any drugs that was metabolized, and any other waste product that can go out. The pH range varies because that partially depends on diet. Color can indicate the degree of hydration. So I don't know if you remember, but antidiuretic hormone, when we were doing the endocrine system, I might have told you that ADH is secreted at night when we're sleeping, because when we're sleeping, we're not really hydrating ourselves. So if ADH is secreted at night, it means that a lot of water will be reabsorbed because the filtration is still going on while we're sleeping. So the ability to produce urine is still, possible. But you probably noticed that the first urine of the day is usually a small volume and sort of yellow or darker in color. And that is what's representative of a very concentrated urine. If you're very hydrated, urine should have just a very pale color, straw colored. It usually should have no smell. If it's allowed to sit for a long time, the ammonia in it starts to give off, sort of sharp odor. And of course, normal urine should not contain blood cells. So if there is, if you find red blood cells, that usually means there's bleeding somewhere occurring in the urinary system. If you find white blood cells, that usually indicates there's probably an infection. Proteins or glucose should not be found. Amino acids also should not be found. So between a blood sample and a urine sample, a doctor can actually figure out quite well, how efficient your organs and organ systems are working. And I think that's the last slide. So that's the urinary system. Certainly, while it produces urine, and you might have thought initially, well, that's just a waste product, what's so important about it? In producing that waste product, the kidney is ensuring that our blood is kept as healthy as possible. It's removing waste products from blood, and it's also helping to balance blood volume, blood pressure, and blood pH. So in my estimate, the urinary system is just as important as the cardiovascular system and the respiratory system. So long.